I'd like to welcome you to our webinar. This is for our 7th Nursing in the Community Week celebration, and I hope you're all enjoying the spotlight this year. Nursing in the Community Week is our opportunity to showcase and increase awareness of the variety of areas and the diversity of ways that nurses contribute to people's health and wellbeing in our Australian healthcare system. So I'd like to welcome, I'd like to welcome Anna Shepherd, our Deputy Chair for the Community of Interest.
Thank you.
Are you there, Anna?
I'm here. I'm here.
And I'd also like to welcome Michael Hall, the CEO of Regal Health. And I'd just really like to acknowledge Anna and Michael and Regal Health's generous support of Nursing in the Community Week. And they've been sponsoring this event since its inception, and this is our 7th year. So thank you.
Kitty. Very pleased to be part of it as well. It's a key part of our calendar each year.
Thank you, Michael. Thanks, Anna. So today we're here celebrating nurses that work in the community, and what we found over the last 5 years that we've been working in this space is that nurses don't often feel like nurses in the community often find it difficult to feel they belong to a bigger group. A lot of nurses are working out on their own. A lot of nurses are working in very different workplaces and delivering practice in different clinical settings. They have their clinical specialty skills and knowledge, and sometimes find it hard to understand how they link across to the bigger picture of the nurses working community. And this year we've tried really hard to look at how these nurses do come together, and what we've pushed out today, this week, and what we're hoping the community can see is that nurses are out in the community delivering in many ways. From the time our children are born, nurses are there supporting us, nurses and midwives, until the day we make the decision on our end of life. Nurses can be there supporting you in many ways. In Australia, nursing is most visible in the hospital setting, looking after the sick, but nurses deliver care in many places, and they deliver in many specialty areas. So I just want to welcome you here, and I'm going to ask Anna to come back online, because Anna and I have done a lot of talking about what nursing in the community is, and we've both travelled this journey together. So Anna, can you tell me?
You're going. Yeah.
You go.
This is typical of Kitty and I. We decided to interview each other for our forum this afternoon because we have had a really great journey together. We've been working together more closely for the last 3 years, but engaged with the Australian College of Nursing for the last 6 years, I think, representing community nursing and primary healthcare nursing. So my first question to Kitty today is, who are nurses in the community?
So nurses in the community, there's many of them out there, and I'll just tell you that I'm a nurse in the community, and I've been a nurse in the community for nearly 25 years now. And I started my journey working as a post-acute nurse. So there were a lot of projects out there looking at ways of getting people out of hospital early. And my first experience as working as a nurse in community, I was given a pager. I was told that they felt like I had good clinical skills. Could I go up to the ward, please, and see if there's any patients there that could go home early, if I could look after them at home. So that started my journey in community. And I think about how I learned things along the way, and it was through the generosity of my patients and of other community nurses I came across that taught me, how to be a good community nurse. There are many iterations of community nurses. So while I work for a state, a health-funded system, predominantly looking at hospital avoidance and prevention, there are many nurses working out there in areas such as health promotion, disease prevention strategies. We have nurses working in public health sector We have nurses working in the corrections services. We have nurses working in child health, supporting new parents and young families. So we have nurses everywhere, and I think that's been one of the most difficult things, is that because we're so diverse and because we're so spread out, it's very difficult to define who we are. So we're hoping that this year we've kind of hit on it by looking at the stages of life and how nurses support, because I think otherwise we're trying to explain funding models to people when, you know, really we need to be talking about what it is that nurses do.
I think to add to that, Kitty, is that nursing in the community covers Aboriginal and Torres Island communities. It covers veteran populations. We look at collaborations between private sector, not-for-profit, working with public sector. You talk about a pager. 37 years ago when I joined Regal, my mother founded Regal, we used to have to supply enema kits to every nurse going out into the community because every patient needed enemas. So look, 37 years later, that's a non-issue because we've moved on as a society, much more aware of what we're eating and our food. And I remember chronic leg ulcers, we never expected them to heal. We had insulin-dependent patients that we were seeing 4 times a day. It was a very different world, and I know that in the 60s my mother was visiting heavier patients with the public sector, and they would meet up to visit patients together and do joint visits with GPs in the homes, and we're aspiring to that today, aren't we? That we can have that real shared care, team-based care. So my next question for you, Kitty, is what are the goals for our community of interest? We've worked hard on this, haven't we? Where do you see our community of interest going in the next few years?
Yeah, so I guess, as I was saying before, that I think one of the biggest issues for us is feeling like we belong to something bigger. And so one of the main goals for our community of interest, and what we've worked really hard on for the last 3 years in particular, is that feeling like we belong to something. So we've been trying really hard to engage nurses in the community and hear their stories and ask who they are, ask them what their practice is, what their concerns are. I feel like we've built a really good picture of what that group, what that group entails. And, even though, Edda, you've hit on another number of nurses, I know, we put a survey out about a month ago, and the responses we got, there's a whole page full of different areas that nursing are working in that we maybe not even had considered, and it's out there. So we've really worked very hard on engaging you as a group, and we hope to continue engaging you. So we want you to feel like you belong. The next thing that we feel is really important is that we want you to be heard. But in order to be heard, we feel that we all need to have a common language. So to develop a common language, we need to think about how we educate ourselves, or how we talk about ourselves, how we articulate our practice. And I think sometimes as nurses, we find it very hard to talk about our value or what it is that we bring to the table, because we're very busy getting on with it and doing whatever it is that we feel that our patients and community needs. So one of our big ticket items next is to talk a lot about that education and trying to develop our own language so that we can all be really clear and speak from the same page. And then the third thing that we're really interested in looking at is how we influence. So how we as a group can influence not only our community, but how decisions are made about the care of our community into the future. And we've been seeing a lot of things happening this year. A lot of the issues that we're seeing around the challenges of COVID have actually put a spotlight on, on the work nurses do in community, because people are looking for other options. So what we also really want to do is, once we get our language right, we want to hear from you, and we want to We want you to help us, help ACN have a voice for us at that bigger table.
I think we've learned a lot during COVID this year, and I know from my own perspective at Regal is that community nurses were the first to go in, were the first to be there when all other services, hospitals were closing down, general practices were closing their doors. I think community nurses were out there continuing. And what we know was we had that opportunity to educate our community and explain to them that nurses are expert in PPE and infection control, and that is keeping our community safe. So I think moving on beyond COVID, that we were definitely visible during that time, and I think that so many people are worried about keeping their family members in residential aged care facilities, and there's definitely a place for people to be cared for with more intensive care. However, there's definitely a place to be able to keep people with their loved ones and with their family members, particularly those that have dementia, and they're much more comfortable within familiar environments. So my next question is, how do you see education as a key to unlocking the potential of nursing in the community?
So as I was saying, I think education brings brings that language and helps us see what it is that we do. I think if we can use education, if we can support nurses as they move into the community setting to see the value of the nursing role within the team. Because we know, when we look at chronic disease, the care of chronic disease, and we look at the care of our ageing population, there's not one health practitioner that is more important than others. We know that the integrated team is where we will get our successes and care best for our community. For nurses to step up and be counted and feel confident to be counted and be confident that what they say is just as important as the other health professionals, I think that's where education can help. So whether it's an in-service helping you articulate what it is, that you do in your practice that's important, or even just doing, even going on to doing postgraduate studies. So understanding the frameworks that we use in community, so that we can talk about what it is that we do as the nurse. I guess for me, one of the best things that doing extra education has been is that I was able to look at the bigger picture. As a clinician, I was often very focused on the patient in front of me and getting the best for them. And I would be frustrated by things, but I would sort of whinge about it and then move on and focus on the next patient. So as a nurse, I'm advocating for my patients, but what I think further education has helped me see that there is a bigger picture, and I should be advocating for my profession so that we can best, do the best job for our patients.
So now it's over to you to interview me now, Kitty.
I don't know if any of you know, but Anna is an honorary nurse. So she is an honorary fellow of the Australian College of Nurses. She's the first non-nurse that was made a fellow of the college. So I find it I find it completely inspiring, and it's been a wonderful journey to have with Anna, because she doesn't think like us. So she doesn't hold herself back the way I feel that nursing sometimes, we find ourselves holding us back. So Anna, my question to you is, what is your drive to advocate for nursing, particularly nursing in the community?
I think I was born into Regal, a private community nursing service. So I didn't know anything different, except I never expected to be working with my mother, as all children say, probably. But I did find myself working with my mother and helping her out for 4 weeks, and that was 37 years ago. What I know for sure is just seeing people being able to thrive at home and in their own communities. So in my 37 years, I've seen elders taken out of the community when retirement villages were introduced in the late 70s, and seeing the impact of visibility of elders in our community. But as I took on a role, what my mother passed on to me was to be of service. So to engage with professional bodies to advocate for the nursing profession. It's seen us establish the Primary Nurse Practitioner Society, and that was to introduce nurse practitioners, and that was in the 1992. We have been very engaged with professional organisations in promoting primary healthcare nursing or community nursing. My drive has been that every time I go away and look at it from my helicopter, or when I look at nursing from a distance, you can't help but look at our health system and look at where it's working and where it's not. And if you ask anybody what they think of nursing, they think about the care that they get, the confidence, the trust. They heal better. I've even gone to the point of looking at the neuroscience point of view. And there's research by Dr. Fiona Kerr on the impact of eye gaze and touch on healing by registered nurses. So I know intrinsically that nurses can give people the confidence to heal and the trust to be supported by nurses in the community. From an economic point of view, and when I say economic, it's the drivers that keep our country thriving and moving. Having the healthiest society is the best society. And nurses are very much engaged in people's lives from birth to death. And I think that they are great collaborators. They're great at reporting any signs or symptoms of deterioration. I think that what we're seeing today, as many problems in COVID, can be dealt with nurses being able to participate with general practitioners and their colleagues in allied health and physiotherapy. So and when I did my studies in public health, it became very clear the role that nurses play in connecting and bringing communities together. So I think it's a social and economic solution to our health system, and it delivers high value care.
So if we're such a valuable commodity in the healthcare system, what do you see that's holding us back? Why have we got the issues that we have of invisibility, of not being heard, not getting seats at the table? What is it that you think is holding us back?
So I've thought a lot about this, Kitty, and I think that I've mentored a lot of nurses, even Florence Nightingale's great-grandnephew. I think that in Australia we have a very interesting dynamic, and it's the tall poppy syndrome. And I think when I interview nurses that have worked in the hospital ward, often it's those nurses that are really good at what they do, and if they put their neck out and are too good, then the other nurses will say, "You're making me look bad." Or if you document to a higher standard than the other nurses on the ward, or that's that kind of behaviour where you're looking different or better, it's knocked down very quickly. And I think that's okay to think about that for a while, but 37 years later, I'm thinking, if I look at doctors and lawyers and accountants, professionals, they're very mindful of their lifelong learning. They're very mindful of how they articulate themselves. They invest in strategies to improve. I look at myself where I couldn't answer questions, I've gone to educate myself. Never wanting to be in a situation where I'm sitting at the table and I can't contribute. And I think nurses are healthcare professionals, and I think that that's in everything you do. It's your personal brand. You have all the evidence to support that you're healers, that you're ingenious engineers of health solutions. I could go on with a long list, and I've posted a lot in social media about what I see as the benefits of nursing. However, I think that critical thinking and that documentation of your practice, I think we have My Health Record. I think you can contribute onto that platform wherever you're able to. I think that makes you very visible. I think you need to think like lawyers and doctors and accountants and engineers, and they're very mindful of how they present themselves in the world and how they contribute. So I think within 24 hours, if that simple shift happened, I think nurses, and in community and primary healthcare, we've got 124,000 nurses. In nursing across the country, we have nearly 500,000 nurses. We have 120,000 GPs and significantly less allied health practitioners. I think we are a powerful force, and I think that our community needs us. We connect people. We're very alert to changes in behaviour and mood and things that will really make a difference to somebody's life. I think of so many times when I've been out with community nurses, and I see them looking at it like a scanner, walking in and you're scanning, you're smelling, you're hearing, you're looking at responses, you're looking to see if the house is kept, if the food in the fridge is fresh. They're all clinical assessment, through the lens of a clinical assessment. And you're wonderful delegators in terms of working as a team. So if I was to say three things, it would be lifelong education, critical thinking, and documentation of your practice. If that was consistently attended to, your community nurses would be very, very visible.
Mm. And I, as you were saying that, I was reflecting on my own journey, and even just working with you, Anna, is I think I have had to learn not to be asking for permission to speak up, and not worrying that what I've got to say isn't important, because I knew it was important. I knew what I wanted to say, but I always was worried about, was that important to other people? And what I'd like to say to any nurses from the community settings that might be listening to this is don't be afraid. What you think is really important. So, have the confidence to speak up for your profession in the way that you have confidence to speak up for your patient. So think about it like that, because we really do our profession needs us. Our profession in tomorrow needs us. And, I heard Mary Chiarella speak years ago, and she just said to me, to us as a group, but she just said, if we don't tell people what nursing will be into the future, someone else is going to tell us what it will be into the future. And so I think as a nurse, every single nurse in Australia, we need to step forward and advocate for our profession.
But also for the community.
Yes.
Because I see things very differently. I know that there's a perception that nursing in the community is cups of teas and visiting people, and it's not as sexy as working in an acute care setting. However, I think those nurses that are working in acute care setting are, we have a lot to be grateful for them going to work every day through COVID. However, I think a lot of those nurses really wish for a continuous relationship with their patient, rather than walking in and seeing bed, Mrs. Jones, day 3, bed 4, may not even really know their name. Whereas you can really heal somebody in the community. You can look at their wound, you can look at their nutrition, you can look at their whole, who they are as a person. And Alan, on our executive, has shared a story with us as well about he was attending a patient in the community, and it realised that every Thursday he was going to change the dressing or the wound, and found out that the patient was taking the dressing off as soon as he left because she wanted to go to bowls. Now, understanding what matters to that person is a game changer, and that's what community nurses do. They ask questions, and they're able to. it's not that acute nurses are any better or worse than nurses working in the community. It's just, I think it's very fulfilling to be able to be there from the beginning of the treatment to the end and heal somebody and know that that person can be independent and then come back and have care again if they need in the future. And I think the way that nurses in the community engage with GPs and with allied health and with families and those involved in care means that people feel valued and they feel important. And that there's a lot to be said for that. I absolutely love doing what I do, and being part of that, and what we can do together. And Kitty and I have a very clear vision about where we're going in the future. The survey that you all completed recently gave us so much information. Our value for 2020 was to ensure that we engage with you, and I think we really feel that we are engaging with you this week, but we want a lot more, and we want to talk to you, we want to be involved with you, and you know, that's very much drives us.
Thank you, Anna.
So in terms of closing and where we are, I think we wanted to share our journey and our story because we have mentored each other, and we've really valued the support of the Australian College of Nursing this year in leaning in with us to engage with the broader community and create this awareness campaign. We're nearly up to 2,000 engagements this year compared to 63 last year. So I think we have heard what matters to you. We've acted on it. We have pivoted, and we have a lot more to do. And what inspires us is engaging with you and hearing from you. So we're here, and we sincerely want to hear from you. So.
Absolutely. So thank you very much for joining us today. You know, Anna and I are only an email away, so we're always very happy to hear from you. We will be looking into different ways of communicating with you into the future. There's some exciting things happening ahead with as far as, you know, communication with ACN, with the way that we can communicate with each other. And we've also, I just wanted to acknowledge that, you know, we had quite a few of you have offered to take part in some of the surveying for policy, taking part in Nurse Click. So watch out for a survey coming your way, or a question coming your way, because we want to start collecting information from you so that we know who the specialists within our community of practice are when the questions are being asked. So we will be making contact with you again in the coming months. So take care of all of you. Enjoy the rest of your week. Shine.
Happy Nursing in Community Week.
Happy Nursing in the Community Week.
Thank you.
Thank you.